Hi there. I'd like to talk about a question that I hear a lot from many of our patients and parents and friends, family, neighbors regarding modern treatments in orthodontics. And I'll read it for you. I'm thinking about doing braces. Is the take-home kit a good idea? What's the difference from seeing an orthodontist to doing the take-home kit and do-it-yourself braces? Well, here's my opinion. There is a very big difference between doing these take-home kits where you get mailed impression trays, take those impressions at home and send them out, possibly with some pictures, to a company, and they fabricate aligners for you to straighten those upper and lower front teeth. That's typically what their goals are. That is pretty much the limit of the information that they get and the limit of what they can do. Reality is what an orthodontist does is see the patient in person. We take x-rays, we check general dental health, make sure that everybody is healthy, make sure that you have no need for fillings, no need for root canals, no need for deep cleanings, that our priorities are in line with the dentist's priorities. And then we develop a full treatment plan based on all the data that we collect to choose the best method possible, which could be braces, could be clear aligners, could be lots of different possibilities. And with all that knowledge, we make good decisions and track our patients over time until we get to our final goal. Now, the other challenge with our do-it-yourself system, or the do-it-yourself systems that are out there, is that there is nobody monitoring those cases typically. There are no x-rays taken and no full diagnosis is done. Again, the goal is really in those cases just to straighten those front teeth and ignoring most of what's going on in the back, which is what we're all trained to do, is to fix bites, get people occluding in the right way, and set people up for a long-term success. Thanks so much. Please keep on forwarding your questions to us, and look forward to talking to you guys all soon.